My story, I mean, basically over the last 36 years of my life, I would say my personal and my academic and my professional paths have come together, and they've put me on a journey or a direction towards driving social change, mainly through improving healthcare, patient-centric healthcare. And at the very base of this is philanthropy. For me, philanthropy is not a project, an extracurricular activity. It's really an attitude and a lifestyle that's ingrained in pretty much everything I do. And that's how philanthropic values were instilled by my parents in us at a very young age. So during the daytime, I worked for Bayer, which is a global pharmaceutical company. I'm with the Oncology team as a global medical affairs strategy lead. And during non-work hours, one of my passions is the Amal Foundation, or Fondation Amal, as we call it in French. Basically, Amal was born in 2012. It's a Montreal-based foundation, and following my MBA program, I came together with a few classmates that shared the same sense of civic duty and philanthropic spirit as me. And we gave birth to Fondation Amal, and our goal is to make a positive difference in the lives of children that have chronic disease and disabilities, in the hope that we can rekindle the way they live and basically give them back that love for life in an inclusive world. And our tagline in French is Redonnons l'espoir, or to give back hope. So what we do is we focus on enriching their quality of life, and we do it through advocacy and fundraising. And the other very important pillar for us is, I would say, empowering today's young donors so that we foster a new generation of philanthropists. And we do this not only by engaging them in initiatives, projects, volunteers, opportunities, etc., but also through academia, which is a key pillar for us as well. I mean, we all come from an academic background, and we realize the importance of academia. So we have scholarships in place as well to support kids, or students rather, that are pursuing studies or a career to support kids with chronic disease and disabilities, so childhood diversity and exceptionality, that are in financial needs. I mean, they deserve the chance to live an inclusive life, and they need to reach their full potential. Just the fact that they have a disability or a chronic disease shouldn't be the determining factor whether they get to their full potential or not. And so what we do at the foundation is we really advocate on the behalf of the family members, to ensure that they get the best possible support and services from the community. And right now there are 100 million children worldwide, approximately 100 million children that have a disability. Most of them have no access to healthcare. They have no access to proper support services, education, so they can't live an inclusive life. And especially, I mean, we really see that discrepancy coming to light now during this pandemic. The other comment I wanted to make here is about the family members that are sometimes regarded as, let's say, the hidden victims, because they experience an enormous amount of emotional, economic and social pressure and strain. And a lot of times that really makes or breaks them, especially during these times. So it's just this vicious cycle that continues to impact the life of these kids with chronic disease and disability. Regardless of the pandemic, this has been a very difficult time. Kids with chronic disease, regardless of COVID-19, they're marginalized, they're a vulnerable population. And right now what we're seeing is these situations of crises are disproportionately affecting this group of kids. Most of them have underlying health conditions, so it consequently puts them at a higher risk of contracting COVID. The fact that we've been social distancing right now to help flatten the curve, there's a high likelihood that these kids, specifically these kids, have elevated anxiety, depression, stress. We're seeing it in adults, we're seeing it in children without any kind of chronic disease or disability, but even more so with this marginalized group. And it's worse for kids that have these pre-existing mental health issues, because they're at a much higher risk for relapse. Education is a very important, I would say, core foundation right now. I mean, the importance of education is critical for children to have some kind of structure and stability so that they weather the storm of COVID. For families in general, it's been a struggle for kids with their education, because they need to work, parents need to work. They also need to monitor the kids while they go through homeschooling, make sure they can access the internet, make sure that they have the available resources at hand. But especially for kids with disabilities, this starts to become very difficult because they need access to special education tools and resources so that they can meet their specific learning needs. And that's not happening right now. So in light of this ongoing pandemic, my message is to really highlight the importance to anyone that's involved in COVID response from whatever industry field related to education, healthcare, otherwise, to make sure that when we're developing clear standards, that they're truly humanitarian and inclusive. So this means that there shouldn't be anyone that would be receiving inferior support in any way, including children and especially those kids with chronic disease and disability. Absolutely agree that we need more philanthropy right now more than ever. I think it goes without saying. If you haven't been a philanthropist in any way, now is the time where you step up. Now is the time where you need to showcase your compassion, your empathy, and be a human being. I mean, we have a humanitarian duty towards supporting others during this time. And it can be as simple as picking up the phone and checking in on your neighbor with a call. Philanthropy is what's going to support the nonprofits and the charities that are currently facing a dilemma. And they're going to continue for the years to come, most likely. Philanthropy is what's going to bring people together and local communities and really help us rebuild the world. And philanthropy is what's going to help us advocate for crucial topics that have fallen off the radar or that have gotten lost, especially during this pandemic. For example, looking at equality for marginalized groups, kids with chronic disease and disabilities, the elderly, the pregnant. I mean, there's racial discrepancies as well. So many of those have emerged. Unfortunately, all of this has come to light because of the pandemic. The other thing I do want to say is it's not just about more philanthropy, but it's about the quality of the philanthropy itself. So we need to redefine our model of collaborative philanthropy such that it becomes a model that is truly sustainable in the years to come. And it can weather other pandemics or other situations of crisis that are going to happen. Why? I mean, most of the time we've seen philanthropic responses and they've been pretty quick and immediate to situations of disaster. Their responses are geared towards short-term crises, but they don't necessarily, we haven't reevaluated how to change them and look at the underlying issues and complexities and discrepancies that would basically prevent them from happening again. So for example, I equate it like putting a plaster in a wound where we don't want to necessarily put the plaster, we want to help the wound heal and we want to prevent it from happening again. So yes, we need more philanthropy, but we also need to reevaluate a lot of the models of existing philanthropy so that they can become sustainable in such events in the future. I'm going to share a moral story. I don't remember the source of the moral story, but this is a story that has stuck with me for a long time. It's about a young girl that basically was complaining every day. So complaining of hardships and challenges and always upset. And one day her father was fed up and he brought her into the kitchen and he put 3 pots of boiling water. And in one pot he put potatoes, in the other pot he put eggs, and in the third pot he put coffee beans. And so, 15 minutes later, the potatoes came out of the first pot. They went in hard and strong, and they came out soft and weak. And the eggs that initially went in very fragile came out hard and resilient. And the coffee beans came out in a unique way. They had taken the boiling water and they had created something new, something positive, something tasteful, coffee. And so the moral of the story is it's not your composition or what you're made of that determines your response to certain situations. It's what truly matters is your choice of how you respond to boiling water, to situations of crisis, to situations of challenge. Right now, our pandemic, this COVID, is our boiling water. And I'm hoping that we see more and more coffee beans where we're seeing more acts of positivity, so that we can change what's happening to us into something new and something better than it was before. This is an opportunity. This is the silver lining that everyone keeps talking about. So maybe just to close, I would say that we're morally and ethically bound right now. We're obliged to become philanthropists in this unprecedented time. And in whatever way you want to describe philanthropy, whether it's through donations, time, efforts, resources, communicating your story, there are a million ways of doing it. Yesterday and now as in today is really the time that's going to dictate how we plan to leave our legacy behind for kids, great grandchildren, future communities, and the world. So my message is, I'm hoping that everyone can find the coffee bean in themselves and come together during this situation of pandemic so that we move towards a better world.